So now we will move on to allergic reactions. This is chapter 20.
I know all about those.
Do you? What do you know about allergic
I'm
reactions?
allergic to everything.
You are?
It really is. We had to get a dog that's
hypoallergenic.
Right. Yeah, you told me that. Good. Good. So you want my notes, or do you think you can just kind of wing it?
Being allergy tested sucks, that's all I know.
Yeah. I've had the blood test done for allergies, and then they referred me to an allergist, but I never did it.
I had 75 shots in my back and 25 in my arm.
Wow. Fantastic. Are you severely allergic to anything, or just kind of
Oh, yeah.
lightly allergic to everything?
They tried retesting me a couple months ago, and they told me I couldn't take my allergy medicine for 2 weeks. I couldn't get out of bed because I was throwing up so much.
Wow.
Yeah. I'm on 2 different allergy medicines. Like, if I don't take it,
If you were in the 1600s, you'd be dead.
what?
Yeah.
Yeah. Modern medicine, see? It's good.
Nature would have won.
You don't have to go back to the 1600s.
Oh.
Allergy medicine's probably been around
I don't know.
100 years, 60.
So your immune system naturally responds to foreign substances in the body, right? We get sick, our body has an immune system to fight it off. Catch the coronavirus, you start to build antibodies, okay? All these things, this normal part of your system, okay? But an allergic reaction is an exaggerated immune response, okay? An allergen is defined as a substance causing that exaggerated effect, okay? So an allergic reaction is an exaggerated immune response, and the allergen is what caused that. Okay, so when we think about allergic reactions, for the most part, as far as somebody calling 911 for an allergic reaction, excuse me, Corona for sure. All right, normal allergic reactions aren't really, you were probably not going to get 911 calls because, right, okay. Minor allergic reactions aren't that big a deal. But usually when we get called is when we get into anaphylaxis. So anaphylaxis or anaphylactic shock is a severe life-threatening condition caused by that allergic reaction. Okay. You have rapid dilation of your blood vessels causing hypotension. So if you want to remember the signs and symptoms of an allergic reaction, severe allergic reaction, think shock, because it's anaphylactic shock, right? So what are the signs of shock?
Elevated heart rate, elevated breathing.
Hypotension.
Yes, yes, hypotension. You say hypo or hyper?
Hypo.
Hypo, yep. Low blood pressure, clammy skin, altered mental status, right? Okay, so all of those signs are going to show up with this, okay? But on top of that, we're going to see some swelling, hives. What else might we see?
The throat closing?
Mm-hmm. Throat closing, tongue swelling up, lips swelling up. Okay, so those are all indicators of a serious allergic reaction. What are some...
That's making that horrible.
Dun, 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 dun. Yeah. What are some common allergens?
Peanuts. Grass, bees, yeah. Milk.
Cats,
Nuts.
dogs, nuts, milk.
What else are you allergic to?
Well, actually, I am.
Yeah.
Right?
Pollen.
Pollen.
Yeah, pollen. Okay. So a lot of those, the environmental emergencies the environmental allergens like grass and pollen and those kind of things usually cause I'm not saying your condition's minor, but compared to true anaphylaxis, okay, you're not going to stop breathing. Like you might be uncomfortable and you got itchy eyes and maybe some coughing and sneezing, that kind of stuff. But we're talking severe. We're way beyond that here when we're talking about anaphylaxis. And the most common one, yes. So one of the most common is bee stings. Peanuts is up there too. Those are some conditions that might cause anaphylaxis. Okay. What about latex? Latex is a very common allergy. That's kind of why the emergency services and that has gotten away from latex gloves, because it's very common. And you can actually develop a latex allergy from wearing them so much. So you start with latex gloves, you use them every day running calls, you take them off, throw them away, of course, you're not using the same pair. But you keep exposing yourself to the latex and you can actually develop an allergic reaction. This may be a test question. I got this one wrong when I took this class 10 years ago. I remember, I'm like, oh, okay. Okay, it's worded something like, you come back from a call and you notice you have a rash on your skin. What might be a cause of that? And there's 4 answers, and one of them is allergy to latex. And I'm like, I don't think that's the right one. No, that was the right one. So, learn from my mistake.
When you take your
Still the
test,
same question and kind
do you get to see what questions you
I don't
got right
know.
at home?
different.
No, you do not, unfortunately. You're taking it, yeah, so the state test, I just got the thing from Ron today that shows how you sign up for it, and we'll go over all that with you guys before, so don't worry. But you will sign up online after you pass the practical skills exam. We notify the state, hey, these people passed their practical skills exam. Then they send you an email. That's why they need your emails. They send you an email saying, okay, here's a link, click the link, create an account, schedule your test. And then you'll go to this place up on 4th Street and take the test on the computer. So you schedule it whenever's available. Whereas in the past, the 3rd Thursday of the month after your class was over, you would sit in the building over there and everybody would take the written test all at the same time. And you'd have to wait 6 to 8 weeks for your results. You don't even know if you passed, let alone you're just waiting for your card, or you failed, letter in the mail. Now you guys will take that test and you'll get the results right there on the spot. Congratulations, you passed. This is your EMT card. You're going to walk out of the station, out of the testing site with your EMT card. So it's a bit of a pain to go through the creating the account and all the whole thing because it's just different. But you guys get your results right now, and that's awesome.
What if that will
Yeah.
make or break your day?
Yeah.
What about the NREMT? How's that going to work?
The nationally registered?
Yeah.
We are not a national registry state at this point, no. If you're a nationally registered paramedic, let's just say you came from Pennsylvania or a state that is national registry, and you want your New York State EMT card or medic or whatever, you submit your paperwork. They may want you to take a test. They may not. We just had a guy get hired earlier this year. He had a national registry card. He got in the military. And when he came up here, he didn't have a New York State EMT card, but you have to be a New York State EMT to get hired at the fire department. So he submitted that paperwork to the state, and like 4 weeks later, he got a brand new, shiny new New York State EMT card in the mail. So the process was pretty easy, but you had to submit the paperwork to the state. So.
What about the other way around?
Leaving?
If you want to have a national register.
That's a great question. I can't answer that. I have no idea.
Certified teacher. Right?
Oh, those are not just.
There's a certain class, isn't there?
So you mean to get, so now you're a New York State EMT. You want to go to Pennsylvania or somewhere. That's a great, I don't know.
You can't practice. You have
Yeah.
to take the,
Yeah, you had to have
You
your
have-
national cert.
yeah, but you
So
can't.
how do you get
It's a
it?
certain class.
My
like the-
wife just did this last year, and she just sent paperwork in, and she went down and picked it up,
Yeah.
Meadville or something.
They're not
She
gonna
didn't
make
have
you
to take
redo
another
the
test.
course.
So they
They accepted her test from here.
okay, so they honored the New York State card, but you had to, so it's the same way coming into New York as it is leaving, it sounds like.
You still
Okay.
wouldn't be nationally certified, you'd just be certified in PA, right?
What's that?
You wouldn't be nationally certified, or did she?
She's only certified in New York and
In
Pennsylvania.
PA, okay.
Okay. Okay. Great question. Yeah, good questions. I don't know. I don't know this stuff.
NREMT is its own test.
Yes.
And Jameson explained it as if you pass this course, you can be green lighted to take the NREMT, so you can get it.
Oh, okay. Well,
So, Jim.
sounds like he knows more than I do. Now, if you're in a department that's neighboring,
Pennsylvania?
if you're on the state border, if you're in a department that's on the state border, or you're working for All-Star, whatever it is, you pick up your patient in New York State, or you get called mutual aid into Pennsylvania. There are some reciprocity things that are allowed. So like, you don't, take your New York patient to Hammett, and as soon as you hit the PA border, like, oh, can't do anything for you now. Sorry. No, that's not how it works. I mean, that's your patient from here. You're traveling across state lines, and it does work both ways. But if you were to take your New York card and you want to move down to whatever, yeah, you're going to have to get that stuff switched over. All right, where were we? Latex allergy. So when we talk about anaphylaxis, it's usually a very, very quick reaction, okay? Usually it's immediately. I mean, within minutes, the swelling and the sweating and the increased heart rate, low blood pressure. I mean, this is all happening very quickly. People can die very, very fast. They say up to 45 minutes. So if it's been 44 minutes and you got stung by a bee, and now you're starting to swell up, it still could be an anaphylactic reaction, but probably not, because those things happen like this. Now, I got stung by a bee like 3 or 4 weeks ago. I was doing a bee removal in a house in Guanda, and I got stung in the wrist. And I've been stung by honeybees before. Huh?
You do bee removal?
Yeah. Yeah, I keep bees. Yeah. You know that? Yeah. No, I do. So anyways, I got stung in the wrist while I was cutting the comb out of this wall. And I mean, it hurt for a second, whatever, no big deal. And I kept working. But what I didn't realize is that I left the stinger in. So like 20 minutes go by, I'm still working, and all of a sudden I start getting really itchy in my armpits and the tops of my feet. And I'm like, oh. So I went to my buddy Sean. I'm like, hey, I gotta go outside. I'm getting itchy. He's like, all right. So I go outside, I take my coat off, and I realize the stinger was still stuck in me. So his entire venom sac in that stupid little bee dumped into my bloodstream. Take my coat off. I am head to toe hives. And I started feeling it in my lips, starting to swell up. And I'm like, oh, I've never had a reaction like this to honeybees before. Like, maybe I'm in the wrong business. So I'm worried. Like, where's the nearest hospital? I'm in Guanda, let's see, you know? And,
Actually.
yeah, so I think the Guanda hospital's closed down.
Is it really?
Yeah. So I took 4 Benadryl and a couple of steroids, because I had these steroids from, I guess,
4 Benadryl?
4 Benadryl. Well, so I got stung, I don't want to get too far off the track here, but I got stung by yellow jackets like 2 years ago, and other than my arm, my entire arm was swollen up like this. Actually kind of looked cool. I was jacked. I'm like, look at the size of this forearm. But it was like, it was like this big. No reaction anywhere else, but just my forearm was swollen up. So I went to the doctor the next day, and she's like, yeah, you should, here's some steroids. And so I had some left over. I brought them with me to the bee removal just in case. I know, right? But, but when I was talking to her, she goes, did you take any Benadryl? I said, yeah, I took 2. She goes, you know, you're only 190 pounds. You could probably take about 200 milligrams. I'm like, okay. So when I got stung there a few weeks ago, I took 4 50 milligram Benadryls, and 20 minutes it was gone. Point is, a pretty good amount of time had passed, but I was still in that window. I'm like, this could be anaphylactic reaction, but it's my fault because I let the venom dump into me. So I kind of just played it out, took the Benadryl, and I was fine after that. So you might get called to that scenario. I got stung by a bee 20 minutes ago. I'm head to toe hives.
I don't want to die.
I don't want to die.
Have you ever seen those sting suckers that like
Oh,
sucks
like
it back out of you?
Yeah.
I have
Green
not.
things that you snap.
So
and
you
then it
like
has-
put it on and then you like put suction to it and
I
it
ordered
sucks the
those on
venom out.
Amazon.
It sucks like,
So
but it's more for.
honeybees are the only ones that are going to leave their stinger in you. Other types of wasps, hornets, and that they're going to continue to sting you, but their stinger is not going to come off. Does that make sense? Yeah, because the honeybee's stinger has barbs on it and it's attached to their guts. So when they sting you, it leaves their stinger, pulls their guts out, and they die.
That's awesome.
You didn't know that?
Why would you do that?
See,
Projection of the hive.
evolution, man.
It's kamikaze, man.
Yeah, right. So they don't want to sting. That's why, generally speaking, they're pretty gentle. But I was cutting their hive apart, so they were not happy with me. But we kept them. We kept the bees. We got honey out of it, and we got them in a box now, and they're doing just fine. Anywho.
Keep those right in the city. For you.
No, I live out in Kennedy. Yeah, I've got up to 8 hives now.
How
Yeah.
many bees is that?
A lot. Probably 40,000 per colony ish, give or take. A couple of them are smaller than others, but
That's pretty awesome.
yeah, it's fun. It's really neat.
You sell the honey?
would I sell the honey? Yeah, but I'm not really, it's not my business. I don't know. It's more of a hobby. I let the bees keep it. I mean, I scrape some out of there and we steal it, but
That looks like
for the most part.
It's getting windy. He's getting windy.
All right, let's move on.
This is personal.
I don't think that's wind, I think it's pouring down.
So up to 45 minutes. If the person gets, were you talking to me? Sorry. I was trying to get back on track.
keeps talking.
You go.
Okay. All right. So if it's less than 45 minutes, if it's pretty quick, this could be an anaphylactic reaction. You might see this progress. So you get on scene and they start with just the hives like I had. Watch that patient real close, because if it gets worse and you see the swelling in the lips and the tongue and all that, we might have to consider giving epinephrine, which we'll talk about in a second. Okay? But those signs and symptoms that you're going to see are the itching, the hives, the flushing, swelling, feel a warm, tingly kind of feeling. That's how I felt in my feet. Like the top of my feet were just super tingly and itchy in my boots. And I was doing this a lot because my armpits were itching. I was like, oh, that's not good. That's not good. Okay, so those are some of the outside symptoms you might see. Okay, then respiratory. So tightness in the throat, cough, rapid, noisy breathing. So they're breathing fast. You're hearing wheezing. That's an indicator that, oh, their throat is closing up. I never had any of that. Okay, but you need to be looking for this stuff. Okay, and then some cardiac symptoms. You're going to see an increased heart rate along with anaphylactic shock, right? Increased heart rate, decreased blood pressure. And then generalized symptoms. What are some of your symptoms, Kristen, of just your allergies?
Lots of sneezing, watery eyes, swollen shut eyes.
Sniffling nonstop.
Sniffly, sneezing, some coughing probably, itchy eyes. Okay. So, so if you were to just put it in one little phrase, the difference between an anaphylactic reaction, anaphylactic shock, anaphylaxis, and a mild reaction would just be the severe respiratory distress. Those are the main things we're looking at. If that person's really, really having trouble breathing, then we need to be giving them epinephrine. But when we're assessing them, the first thing we do is our primary assessment, right? ABCs, AFPU, all that stuff. Okay, we want to try to find out a history of their allergies. Okay, you got stung, so what? Did you ever have a reaction before? Yes, I have an EpiPen. Okay, so you probably had a reaction in the past. Okay, exposure, how long were they exposed to whatever substance it was? If it was peanut butter, I ate a whole jar of peanut butter, and my kid who's allergic got into a jar of peanut butter and ate the whole thing. Okay, different situations can happen. How long has it been since this happened and you called us and we got here? How long has this whole thing been going on? Okay, so if it takes us 20 minutes to get there and it took them 20 minutes to call and the person's still alive and they're not having severe respiratory distress, we're probably not to the point of anaphylaxis, because now we're looking at 40 minutes. Does that make sense? Okay, and what interventions have been done? So did you already give, maybe you have an EpiPen, you gave yourself your EpiPen, okay? I've been to a couple calls where they're like, yeah, I got stung by a bee, so I used my EpiPen. Where'd you use it? Like, where did you inject it in yourself? Well, the doctor told me to put it right into here.
Outer thigh.
Okay. Did you hold it? When you did it, did you hold it? Well, no, I just did this real quick. So they didn't inject themselves properly. 10. Yeah. Yep. So the point is, and the same thing with, we're going to talk about this with the Narcan section too. People don't always know, especially in an emergency situation, how to administer these medications. So if they say, oh yeah, I gave my EpiPen, you need to ask the questions like, where did you use it? How long did you hold it? Look at it. Is it like in date? Is it expired 10 years ago? Because Epi kind of wears off after a while. You might be just injecting yourself with nothing or something that'll make you sick. Okay. All right, so then epinephrine is the medication that we use for anaphylaxis, to treat anaphylaxis. Okay, and what epinephrine does, it's commonly prescribed for people with allergies, severe allergies. Okay, it constricts the blood vessels. So the allergic reaction dilates the blood vessels, right? So now they're big and your blood pressure is really low. We give Epi, it's going to shrink your blood vessels back down to where they should be and bring your blood pressure up. Okay? And then it's going to dilate the bronchioles. Okay? So the allergen is closing up your airway. This is going to help open it up. Okay. The side effects of epinephrine would be an increased heart rate and increased cardiac workload. So they're going to get the jitters. Okay, they're going to be shaking, probably a little shaky. Their heart rate's going to be high. That's totally normal with epinephrine. Okay. Okay. So there's 2 different doses. I'm going to grab the EpiPens out there in a second, but I'll finish this up. When we give epinephrine, when we give any medication, we have to document the time because we can only give these medications in certain increments, okay? And we need to reassess after we give them to make sure it's working or it's not working, whatever it is, okay? And we can only give it so many times per our protocols. That's why we have to make sure we're up on our protocols. Okay, but always document the time you gave it. You hit that EpiPen right there, 6:58. Okay, hold it for 10 seconds. Okay, document that time. Write it on your glove, write it on a notepad. If you have a helper that's taking notes for you, that's always helpful. Whatever it is, just make sure you remember the time because you don't want to give it too often, right? Okay, and there's 2 doses, and this will be a test question. I can almost guarantee it. There are 2 doses of epinephrine that we'll give. There's an adult dose. Can somebody tell me what the dose is? 0.3 milligrams. 0.3, not 3.0, not 0.003. It is 0.3 milligrams. And the pediatric dose is just half of that. So 0.15 milligrams is the pediatric dose. Got it? Okay, let me grab the auto-injector real quick. Some of you have seen this, I'm sure. So what we'll do for one of our skills next week is we'll do the EpiPen demonstration because I have to show you guys how to draw up the medication. Most of us have the check and inject. Do you guys have the check and inject? Or do you carry EpiPens?
We had EpiPens, but now we have to draw up Epi because they didn't have any.
Okay, so you have the check and inject kits where you draw it up out of the bottle. Okay, does anybody still have the EpiPens? You guys do. Okay, so you have to, your ambulance, you have to choose one or the other. You can't carry both for whatever reason. But you guys who have the check and inject, that's...
We have a child and an adult.
Right. But all of us need to know how to use the EpiPens because we can help administer their own EpiPen if we're in that situation. Does that make sense? So we'll do a demonstration on the EpiPens, the drawing up the medication, putting the Narcan together. We'll do all that stuff next week out there for skills.
Do we have the practice EpiPens?
We have the practice EpiPens, yep.
Because I know we do at Spartan too.
Yep. No, we got a whole box of them. We got a whole box of them up in the other building. I'll have to go get them.
Can we get EpiPens?
Can you administer? Yes. Yes. So let's talk about that real quick. And then we're done with this section.
What if they don't have it? It's their first time.
Right. So that's where you get into your protocols, and this is why you have to know your protocols. Okay. If a person is exposed to a known allergen, so this person, let's just use you for example, you are deathly allergic to bees, and you just got stung by a bee, and I'm here, and I got epi, okay? But you're not even having severe respiratory distress yet. But you know that this has happened before. I can give you epi because you have a history of true anaphylaxis. Does that make sense? I have a history of anaphylaxis, and I just trouble breathing yet, but you know last time you had a severe reaction, I can give you epinephrine, even though you're not having all those symptoms yet, because you have a history of it. Now, Kristen, you do not have allergy to bees, okay? But this is hypothetical. Hypothetical. You do not have an allergy to bees, okay? But you just got stung by one and you are having severe difficulty breathing, you have hives, you have all the symptoms of an anaphylactic reaction, but you don't have a history of it with this allergen. You can give epi because of the severe respiratory distress and the life-threatening emergency that's going on. So we can make that decision to give it even though she doesn't have a prescription for it because we identified it as anaphylaxis. He gets it because he has a history of it. So you can give it in either case. He doesn't have to have the severe respiratory distress though because he has a history. Do you guys understand that? Yeah. It's written just like that in the protocol. When that protocol first came out, we really had to sort it out. We're like, wait, what are you trying to tell me? Can we give it or not? If you just read it carefully and just kind of figure out what it's saying, that's what it's saying.
So for Clark, it would be a just in case it does react.
Yep. That's being proactive because he has a history of it. She doesn't have a history of it yet. Well, she will after today, but we can give it to her in that case.
Since you like bees so much, do you know if it matters what kind of bee you're stung by?
It does. That's a good question.
Because
Yeah.
I got stung probably like a year ago
Mm-hmm.
in the thumb, and nothing happened. The
Mhm.
stinger didn't stick in or anything, but I took the precautions, like I didn't take an EpiPen or anything, but I can't remember because I was like 3 years old last time. I
Yeah.
had an allergic reaction. I don't remember if those stingers stuck or not.
So honeybees, okay, let me tell you the difference between bees and wasps real quick, not to get too far off track here. Honeybees and bumblebees are really the only real true bees. We use the word bee for wasps and hornets and all that, but they're all types of wasps. So there's bees and there's wasps, okay? Bumblebees and honeybees have a certain type of venom. Wasps have a different kind of venom. They all carry a venom. Honeybees have a very potent quantity of that venom, whereas wasps don't, but they can sting you multiple times and keep injecting you with more and more venom, whereas the honeybee can only sting you one time, but it's a larger amount. Does that make sense? So whatever reaction you had to, say, a wasp, you might not have any reaction at all to a honeybee, or vice versa. Because I got stung by yellow jackets, well, they're a type of wasp, underneath my watch. I got stung twice, and that's when my whole arm swelled up, and that's the only reaction I had. When I let that honeybee's venom dump into my whole system, I had a pretty borderline serious reaction to it. So that's how they are different. Your body will react differently. Does that make sense?
Honeybees, they die after they sting you, right?
Yes.
That's what I thought you said. But
Yeah. Because their stingers have barbs on them, so when they get you, it pulls their guts out and they die. But it puts off a pheromone, so all the other honeybees will be like, "Oh, somebody just stung," and it'll draw you right to that spot. So when you get stung and you're beekeeping and you get stung, you pull a stinger out. I knew that, but I didn't do it. But you put a little smoke on there. 'Cause you have a smoker with you, you know, a little puff.
What does that
Ever seen it?
smoker do?
Puts them to sleep.
Doesn't put them to sleep, but anyways, you can mask the pheromone with the smoke. The smoke, the reason you use the smoke is there's two theories. One, it calms them. The other is that it makes them think, it's just evolutionary, just defense mechanism. Because honeybees generally would live in a tree somewhere, in a big tree trunk. So they've evolved that way. So when they smell smoke, they think forest fire. So they go down into the hive, start gorging as much honey as they can so that they can leave if they need to. So you give them a little smoke, they think, oh, we got to get some food and get out of here. So it does one of the two things. There's two different theories. Either way, it does help calm them though, because it either distracts them or it just calms them. I don't know.
They keep moving around.
Yeah. Oh yeah, it doesn't put them to sleep. No, they keep moving. They just they go down inside the hive, and sometimes they fly out, but they're less likely to just dive bomb your head. So, all right. So next week, one of the skills we do, like I said, will be epinephrine, both types of epinephrine. Okay, and we'll get the other Narcan. Right now I have the 4 milligram, and we'll talk about Narcan now, unless you guys want to take a quick break. We're doing good on time.
Keep talking.